Welcome back, everyone. This time, I emphasize to consult with your provider for further questions and or concerns. This is not meant to treat, but to provide basic knowledge that will prompt you to either seek professional advice or not. So, the topic today will be cough that can be allergy. Cough of certain etiology, but suspected allergies or allergic rhinitis. Given the lack of fever, this could be allergy mediated. However, could also be related to like post-infectious status with previous upper respiratory infection as trigger for post-nasal drip and subsequent nagging cough. There will be instances that the provider will provide a trial of cetirizine, use as directed, and parents aware to avoid triggers as well, and to remove the allergens after coming from the outside. Parents to follow up in the clinic in a month if therapy is unsuccessful, and will consider dual therapy with Flonase. Parents should also verbalize the understanding there's a lot of anticipatory guidance that you need to go through with the parents, and if they have any questions or concern, address them accordingly. Again, this is only a basic knowledge of common cold that can be allergies. Always seek professional advice, urgent care, or emergency room visits. Thanks again for tuning in.